So, McKenzie, thank you so much for joining us on The Patient Story.
Well, thank you for having me.
Yeah, we're really excited to be able to share your story, especially your energy. I think a lot of people are going to get a lot of great energy from watching you and reading you. So,
Thanks.
and I know this was pretty recent for you in terms of the cancer experience. So let's dive right into it. I know you had shared with me, but let's talk about how you started to know something was wrong. What were those first symptoms?
So, September of 2019, I started working at a daycare, and then I kept getting sinus infections, and I just kind of was like, you know what? It's probably just because I'm around kids that are getting sick all the time, and I just didn't think anything of it, and then I just kept getting them over and over again, and I was like, this is weird. Something isn't right. And then they had a sinus infection 3 times. And then when it got to be February, I got my period, and it was the period from hell, and it just was awful. And then I just didn't feel right. My mom was like, no, it's fine. Next month, if it's still really bad, then we'll go see the doctor. But I just didn't sit well with me. So then I went to the doctor, and then they everything looks pretty normal, and they took my blood. And then I went to work for 5 minutes after the doctor's appointment. And then I got a call from my doctor, and she was like, actually, your blood work is not good. You need to go to the ER immediately.
Wow.
So then.
Oh my gosh. So that changed very quickly.
Yeah.
Before we move any further, so the period, it was just really heavy. Was it painful?
No, it wasn't painful. It was just heavier than normal, which just wasn't normal for me. I know some girls get really heavy periods, but mine is usually pretty light. So when it was really heavy, something just didn't feel right.
Gotcha. So the doctor calls you a few minutes later, says, go to the emergency room. I'm sure you had questions, or was it the end of the conversation?
Yeah, she was just like, your counts look really low. And then I was like, okay. And I started crying, and then I called my mom, and she's like, it's fine. You're good. And I was like, all right, cool. So we go to the ER, and then even in the emergency room, both of us were just laying in the hospital bed watching SVU, and we're like, this is fine, everything's fine.
So you're talking about Law and Order. so so you get to the hospital. When you went there, did it take a while to get into a room?
Yeah, well, so I was 21, and so they were, and I still had a pediatrician, so they had a hard time, because they're like, should we put you on the adult floor? Should we leave you with the pediatrics? So then they had a hard time putting me in a spot, and then they kept having people come in. Then they took my blood, and then I got a CAT scan to make sure there was no tumors or anything, and then that came back clear. And then the hematologist came in, and then he was like, all right, we're going to tell you all everything that it could possibly be. And then I remember he said blood cancer. And then I started I to start crying. And then he left. I looked at my mom, and I was like, blood cancer? And she's like, no, it's definitely not that. They're just they had to tell you all the possibilities. And I was like, all right, yeah, you're right. And then later that night, I got my first bone marrow biopsy.
So before we get into that, because I know that's a whole nother thing,
Yeah.
with a CAT scan, can you, so the CT scan, can you describe the process for people who haven't had one?
Yeah. So I just laid there, and I was so nervous, because I never did anything like that before. And I just remember the nurse there, she's like, all right, we're gonna I think they gave me an IV of something, and she's like, it's gonna make you feel like you're peeing your pants. And so then I was laying there. I was like, they just had to tell me that. And I laid there, and just laying there, and then it actually does feel like warmth in your whole body. It feels like you're actually peeing your pants, but you're not. And then it's done. It was really quick, but it was nerve-wracking being in that little thing.
Right, the little machine, and they're
Yeah.
and you're talking about the contrast dye that you had to get injected with,
Yes,
right?
yes. Yes.
I remember the feeling too. You definitely feel like you have to pee. The good news is you're not.
I know. I got up and I like made sure. I was like, did I actually pee?
Because it does feel so real. Okay, so thank you for sharing that, but it's very quick. Do you remember about how long it took to get the results from the CT scan?
It wasn't long. I couldn't have been more than an hour.
Okay, right. And so you were in the hospital, maybe that's why it was a little faster. They were able to read
Yeah.
the results. That looked clean, but the doctor is saying all these different things. So did the doctor then say, okay, the next step is the bone marrow biopsy? That's where we'll really figure stuff out?
Yeah. Yep.
Okay, can you describe the bone marrow biopsy?
So, I thankfully my mom was with me, and I remember I was laying on my side, and then they they numbed me. They numbed like my whole hip because they do it on like the like my lower back, like basically on like your back dimple. That's where it's basically where they do it, and they like numbed it, and like that really hurts. And then they like cut me open a little bit, and then they like drill in and take out the bone marrow, and it like hurts so bad, like the pressure of it. It's like worst pain I've ever felt in my whole life. But like I was really grateful that my mom was in the room with me. And the nurse, the doctor who did it was really nice.
Do you have any sort of tips? Because people who haven't gone through it yet might be a little nervous about the experience. And different people have different pain tolerance levels too. But
Yeah.
and
I just like really like focus on like my breathing. Like I remember like especially for the first one, like my mom was like trying to talk to me to get my mind off of it. But like for me, that wasn't really helpful. Like I just needed to be like in the zone and like breathe it out rather than like talking. But like everything is different for everyone. So now my mom knows, like she doesn't say anything to me. She just lets me breathe.
I gotcha. So people can think about what helps them get really centered. So for some people, maybe it's a distraction talking to someone, but for other people like you, it's like a mindfulness sort of internal zoning out kind of a thing.
Yeah.
Okay.
Hmm.
So after, and that took what, like 15 minutes or so, or?
Yeah, like and like with like they gotta prep and everything, so it probably took like maybe like 20 minutes at the most. Like it's honestly doesn't take that long.
Okay, great. And do you remember how long it took to get the results from the bone marrow
Uh,
biopsy?
so I got the biopsy done like maybe at like later that night of like my first day there, and then that next morning I got the results.
Okay. So I'm imagining the doctor is coming in to tell you the results, or
Yeah, he came in and told me the results.
can you walk us through that, Mackenzie?
So I was there that morning, and because I slept over at the hospital, which was like my first time ever sleeping at the hospital. And he came in and he was like, so like we are 99% sure that it is acute promyelolytic leukemia. And then they just started telling us that they're going to like get me out of that hospital, and then they transfer me to Brigham and Women's in Boston. But he was like, we're 99% sure it's like this particular one, rather than like a different type of leukemia. Um, and then like I just like started crying, and I looked at my mom, and she's like, it's all right, it's okay. I think my mom just like didn't want to like realize that it was like real. And then I just also remember like my grandmother came in that day, and then I just like looked at her, I started crying. So that was a very emotional day.
Of course, you just hear this, like in the beginning, it's like it could be blood cancer. You're like, and your mom's like, no, it's not. And then it's maybe leukemia, and no, it's not. So when you're finally getting that diagnosis and it's hitting you, um, was there anything that what helped you the most in terms of processing that, or was it kind of a blur?
I blacked out a little bit when he told me that. Like he kept talking about other things, and I was like, oh, you just threw a bomb at me. I'm not prepared. I just was like I think for a split second I was like, holy crap, like I could die. But then like after that I was just like, you know what, like I'll get through it. Like I don't know, like rather me than like someone else. Like I know that like I could get through it.
Okay, so it sounds like you're a very positive person just naturally.
Yeah.
Okay. So you get this, of course, this is like crazy news for you. You're trying to digest it. What happens? Like, are you having to stay at the hospital for more tests or?
So
Oh, that's
I
right. They
stayed at,
transferred you. Yeah.
yeah, like I was end up being at the hospital for like a month, like 3 weeks. I was in the hospital.
Did you get transferred that day? Like the day that?
No, it was. I think it was the next day. It was the next day.
So, a minor note, but this is one of those human sort of notes, is obviously you're in it for the long haul. Did you have to go home and pack? Like, what was that day like in between?
So I couldn't leave. They put me like in the like ICU, and I wasn't allowed to leave my room because like since my counts were so low, they didn't want me to get sick. So I wasn't allowed to leave. But like my mom, my dad, and my boyfriend, they all like brought me things. Um, so
Okay.
then like I was comfortable and everything.
And what were the things that you found most helpful? Like, if people are packing for the hospital and they might not think of it, what is your recommendation?
I had a weighted blanket, and like that was like felt like it made me feel so relaxed because the first couple of days I was so anxious. But when I was staying at the hospital for like when I was like, in my room at Brigham and Women's, like I really liked having like my own pillows, like at least like a blanket that's like yours from home. So like when you're sleeping, everything like doesn't feel like you're like like somewhere you're not supposed to be, even though like you are, but like makes it feel a little bit more homey.
Right, absolutely. So bring personal touches, things that'll make you feel like you're more in your own room. And then before we move to your major stay at the hospital, um, the first night at the hospital, I know, for instance, like nurses will often go in and check vitals, and people aren't expecting it. Like, what weren't you expecting? What can you tell people ahead of time about that first night at the hospital?
Oh, I don't know. I think the vitals was like something I didn't expect. Um, I don't know. I think that's really the only thing.
Can you describe what they would do, like how often they would go in, what were they checking for?
Like the first couple times they came in like a lot, but then like when I was there longer, I feel like it didn't. I mean, it didn't feel as much. Probably just because I got used to it. They would just come in. They'd take my temperature. They would take my blood pressure. That was pretty much it. But
Okay.
like my first night was like kind of scary because I remember there was like a snowstorm going on, and I was like, of course, it's just so much craziness in one day.
Of course, like everything has to happen this way. Okay, so then when they moved you to the new hospital, did you just go in your mom's car, or was it?
I went in the ambulance, which was my first time in an ambulance, which was really scary. But my dad went into the ambulance with me, which was nice.
Anything you want to say about to people who have never been to an ambulance or in an ambulance, like to help them prepare?
I really don't know. I was like so anxious and scared the whole time. I think because I feel like once I got in the ambulance ride, everything felt real, and I unfortunately have nothing else to say.
Okay, so it happened pretty quickly. The ride wasn't too long.
It wasn't too bad. Like it was maybe like a half an hour
Okay,
ride.
okay, and then
But
when
my
you
dad
got,
was like talking to me, keeping my mind off of it.
gotcha. So it's good to have support there, of course.
Yeah.
And when you got to the new hospital, yeah, walk us through the next steps.
So when I got to the new hospital, it was like crazy. They were just like asking me questions, and then like they did vitals there, and my room at the new hospital was a lot nicer than the one at my old hospital, which was nice. It was a little bit of an upgrade. And but then my doctor came in, and then he wanted to do another bone marrow biopsy. So that was that was nice. and and then after that, then it was and then so I got my biopsy, and then like later that night they had to give me a bag of blood. And I forgot to say that my first night at the first hospital, I got a bag of blood and a bag of plasma, which was very scary too, because I was like, wait, what's happening?
Can you tell us what happened with that? Like, what happens with those transfusions?
It just like, they just hooked me up, and then it takes a while, and it was like a little scary because I didn't think anything was wrong. So then I'm like, well, they're giving me things like blood, like clearly something is wrong. So just like made everything feel real and like a little scary.
Right. And so it was because both your white and red blood cell counts were low?
Yeah.
Okay,
And
gotcha.
my platelets were low too.
Yeah, your platelets were low. Okay. So you got your second bone marrow biopsy done. Was it any different than the first? Anything?
It was worse than the first time. Like my nurse practitioner did it, and like she had a hard time getting in, and she had to like keep going back in multiple times because my doctor was like, nope, you're not getting enough. So that that was not fun. So it
Gotcha.
wasn't as quick and not painless, but it wasn't as fast as the first one.
So you still did your mental exercise of trying to zone out everything else?
Yeah, I tried to.
And then how quickly did you get those results and what were they?
They so I the next day they got the results, and it came back that it was acute myeloid leukemia.
Okay, so it was confirmed.
Hmm.
Were you going to say something? I didn't mean to cut you off.
No.
Okay, great. So you have that second bone marrow biopsy, and then how did they describe what the treatment was going to be?
So the treatment was so every day I took like Atra, and like it was like a pill to like I think it was just to like speed up like the process of like making my red blood cells, or I'm not 100% sure. Just one of my chemo pills. So I was taking Atra in the morning and that night, and then I would get an infusion of arsenic every day while I was there. And then after that, like once I was able to leave the hospital, then after that I would get another biopsy, and then it would be a 2-week break, like off of like nothing. So no pill, no infusion. And then after that, then it would be 4 weeks, every 5 days on, 2 days off of like the arsenic every day. And then the Atra, like 2 weeks on, 2 weeks off. And then for like I think it was, and then it was for like 8 months. So it was kind of confusing.
Wow, that's a lot. Yeah, I might have to revisit.
I'm
Revisit that.
trying to explain it again.
No, that's great. But the first major hospital stay, it says you were there February 27th through March 24th. So you're there essentially a month almost.
Mhm.
And can you walk us through, with the chemo, like, so with the pill, and then the infusions, by the way, did you get a Picc or a port or anything?
I got a Picc line.
When did you get that put in?
So they told me when I was at the new hospital, they told me like for sure that it was APL on Saturday, and then I got my Picc line put in on Monday, and then I started chemo on that Monday.
Wow, so right away. And for people who aren't familiar with the Picc line, can you describe that, the process of getting that in and what it is?
So it's just like a line. It just goes like basically like I think the tube goes like to like one of the parts in your heart, and then just it like dangles. I wish I had a picture. It's like easier to explain, but and then they can just like hook it right up to it,
Right.
and I remember that they did it right in my bed at the hospital, and it really wasn't that bad. They like the thing that hurt the most was when they numbed my arm. I didn't feel anything else after that.
Okay, that's great. That's great to hear. It is
Yeah.
painless after the numbing. And any tips for people on how to maneuver with Picc line? Because I remember mine and the dangling and showering and all that.
Oh yeah, showering was the worst. I like would have to like put like gauze, and then like the little clear aqua pads, or I forget what they were called. Oh, it was showering was by far the worst. And I also got like little covers for it. Like on Amazon, you can get like different colored little covers. So I had a whole bunch of colors. So when I had it, I would just put a little cover on it, pull it back.
So you got the hang of it after a while.
Yeah.
Okay, good. Good. So with the chemo, that first month, so it was one pill every day, or was it
um, it was like 4 pills twice a day.
four pills twice a day?
Mhm.
And then and then the infusion was the arsenic. That was an actual infusion. And
Yep.
how long was that again?
It was 2 hours.
And was that how many days a week?
So for when I was in the hospital, it was every single day. But then once I was out of the hospital and I was doing outpatient, it was 5 days a week.
It
Every
was,
day.
sorry, say it again, 5 days a week?
Yeah.
Okay, okay, so just not the weekends.
Yeah.
But in the hospital, it was every single day.
Yeah.
Can you describe, you know, when you started to feel side effects and what they were?
So with the pill that I was taking, I got really, really bad headaches, and that started like right when I started taking them. And then I feel like the first couple days of infusion, I felt fine, and then maybe like a week after, I was feeling like really nauseous, like I couldn't eat anything, like I would eat the same thing every single day, and it was like bland, like just like nothing with a smell, like made me so nauseous. And then but then I think I started to get used to it, because then the nausea went away. And then and then after a while, like when I stopped treatment for a little bit and then I started it back up again, um my hair started to thin. um
Okay.
that's pretty much it. Yeah, but the headaches were really bad.
So headaches from the pills, and then there
Hmm.
was like nausea, bland taste, no smell food from the actual chemo. And then the second time around, your hair was thinning, but it didn't fall out. Like
No, it did not fall out.
that will be good news for a lot of people.
Yeah. That was one of the first things my doctor said to me. He was like, your hair is not going to fall out. I was like, all right. But it was
um,
weird, like, with that it was thinning. Like, I remember, like, waking up and there was, like, hair on my pillows. And I was like, did he lie to me? Is my hair actually going to fall out?
so people shouldn't be, so they don't have to be that nervous. Your hair may come out a little bit, but it's not going to fall out the way that you see with other chemos. Um,
Yeah.
okay, great. And with the headaches and the nausea and the eating and stuff, did anything help? Did you find anything that helped you?
With the headaches, they prescribed me with like Furacet, which like had like caffeine in it, which like really helped. And then I would just make sure I would take it whenever I could. Like if it was like 8 hours, I'd make sure I'd take it on that 8 hours, and I would take Tylenol. Also, I would ice my head, which would feel really nice. And then with the nausea, I would just like eat whatever I could, like when I wasn't feeling nauseous. And then I would, if like it was really bad, I would take the Compazine.
Okay, yeah, so you would take anti-nausea medication.
Yeah.
And with both the headaches and the nausea, I mean, I hear from some people, like nurses say all the time, get out ahead, even if you're not feeling it, take it before you start to feel it. Did you start doing that?
Yeah, like they would, like when I was in the hospital, like they would give it to me like before I would take like before they would start infusion.
Okay, gotcha. Can you describe, so you're in the hospital for this long period of time, it's extended. Just describe overall, like how you were able to pass the time. What was the hardest part of it and what helped you through?
I wasn't able to like eat outside food because I was neutropenic. So I was always jealous when like I knew my family and friends were like eating like a cheeseburger, like going out to eat. I know that sounds like so weird, but like I just really wanted to eat real food. And then someone was always at the hospital with me. Like I was like a brat and I always wanted someone there with me. Like I didn't want to be alone. And also I tried to make my hospital room feel like as homey as possible. Like I had like pictures all over my walls, and like we had like a wall in my hospital room of like a whole bunch of Polaroids. And like so whenever someone would come and like visit me, we would take a picture and I'd put it on the wall. And I would also, like, something like funny or silly happen, we would like write it down on a sticky note and we'd also put it on the wall. So like, I don't know, because I mean like obviously it was hard on me, but it was also hard on all my family and friends. So I think we all liked it to like look at it and be like, oh my God, like that's so funny that someone said that, or like, oh, that's such a cute picture.
Yeah, nice personal touches for you to all remember these nice moments. Actually, on that note, some people, and of course this is different depending on personality type, but it can be very overwhelming to have too many visitors or too many people checking in on you, especially right when they find out you have been diagnosed. Do you have any tips for people on how to like manage that?
That was really hard for me. Like I am like such a people pleaser. So like whenever someone would be like, oh, like, can I come visit you? I would just feel bad and I'd be like, yeah, sure. And then I'm like, wait, like I haven't seen that person in so long and I don't talk to them. Like, why did they like, why did I say yes? But I was like, you know what? It's more for like them to feel good. And I don't know. I would just let anyone come and see me. But then I feel like now I'm like, why did I do that? But
Total, no,
there
I
was
hear
always
you.
someone there.
Yeah, I hear you because you had said, like you called yourself a brat earlier, which I don't agree with. Like when you want someone, there, but it's one thing to have family there and another to have a bunch of different sort of visitors. So what I hear you saying is draw boundaries for yourself. Like just take care of what you want. Don't worry about other people.
Exactly. And I just think that I had a hard time. Like, I just worried. I do this now. Like, I always worry about everyone else. And I feel like I feel like you can be selfish. Like, it's your time. Like, you're going through something, you can be selfish.
Yeah,
And I wish I was like that.
if there's ever a time to be able to focus really on you, right? It's like you're dealing with cancer. So, okay, that's great advice. Did you also start to, some people will like have family members answer questions for people, or maybe they'll blog or something so people don't constantly ask them the same questions. Did you find
Yeah.
a way to help yourself with that?
So I did make a blog where I would like update it like once in a while because I feel like it was always I was telling my story like over and over again, and I like got like it was like on like auto repeat or whatever. I just kept saying the same thing over and over again, so I like wrote it all out. So then I felt like if someone saw me like out, they like wouldn't have to feel the need to ask it because like I was sharing my my story on the blog.
Exactly. So they have all the same updates. Okay, great.
Yeah.
So at what point did they do another scan, or how did they check how you were doing before they let you out of the hospital the first time?
So they let me out of the hospital like earlier than like they thought. My doctor was saying that my counts were going up. So then I was able to leave like I think it was like a week or so early, and then but I was still like I still had to go to outpatient like every single day until they did another biopsy.
Okay,
So then they got the biopsy, and then my counts came, like everything looked good. So then I was able to take a 2-week break and then start the 4 weeks on, 4 weeks off whole situation.
gotcha. And so when you say biopsy, you mean another bone marrow biopsy?
Yeah.
Okay, so you ended up having to do a good number of biopsies.
Yeah. Yeah.
Did anything else help? Like you've gone through a bunch now. Any other advice for people, maybe?
I'm like I honestly don't know. I feel like I started to get really anxious before them just because I knew what was happening, and then I started taking like a lorazepam before because I just feel so anxious.
Yeah,
It's scary. I don't know.
yeah, no, and that's actually great to hear, right? It's like it's okay to feel nervous when you go through something
Yeah.
over and over again, and it's okay to ask for something to help you. So, was lorazepam? It's helping you with the anxiety a little bit.
Yeah.
Okay, so the advice I'm hearing is if you're feeling something, don't be afraid to ask for something to help with it.
Yes. Yeah. Exactly.
Okay, great. Your counts, you were able to go home for a couple weeks, and then you started the 4 weeks on, 4 weeks off. So, how many times were you in the hospital?
Just that one time, but then I would do outpatient, like at Dana Farber.
Gotcha. And it was 5 days a week for 4 weeks in a row?
Yeah.
Okay, that sounds like a lot too in terms of having to go in. So, um, any advice to people on how to manage, like you're driving in, staying there for, I don't know, how long were you there each day?
So it's like an hour drive there from my house. So I was able to like stay home at my house.
Okay. But when you were at the clinic, how long were the infusions?
Oh, it was 2 hours, but the first day it was always longer because I had to see my doctor. So it would be like, some days it would be all day. Other days I'd be like in and out 2 hours. So it just like it would just depend. Like if it took them a while to like get my drug like processed, like, but
Yeah. Actually, that's a great point to bring up for people just so they know to expect it. When you go into a clinic, you're expecting to get your infusion. It depends on how many other patients there are, how long it takes to get the chemo drugs, right? So sometimes it really varies.
mhm.
Is that right? Is there anything you'd like to
Yeah.
add about the waiting, like what to expect?
I don't know. Someone would always come with me. So I would always have like company, and like you just sit in the chair. And the one at my hospital, which was nice, it was heated and it vibrated. So it made
Oh,
it a little bit nice. But like waiting was like annoying because you're just like, I just want to get in and out. So like sometimes it just felt like really long.
okay. And then over a period of, I'm sorry, how many months again was it? 8 months that you did the outpatient?
Yeah.
So then it was basically four months where you'd have to go and then 4 months off in between.
Yeah.
And so Mackenzie, that's a long time. Do you have any like tips for people on like how to pass the time, how to think about your treatment? Because after you're done, you'd be like, oh, I still have this much to go, or how did you manage that?
I don't know. I remember like whenever like I would finish a cycle, like my dad would always be like, all right, like one down, just like three more to go. And like I felt like that would always be like, yeah, like I finished one. Like it's an accomplishment. Like finishing it, like each one like is like such a huge accomplishment. And then I remember just like the last one, like just being like, I can't believe like this is my last one. And like
Yeah.
even like the last week of treatment, like I feel like I felt like sad. Like I loved my nurses. Like they like were like my friends. Like I was like, oh my god, I can't believe I'm not gonna see them every day. And like after each cycle, I was like, oh my god, like I can't believe I'm gonna go 4 weeks without seeing my nurse. Like I love her.
Oh, yeah, you develop strong bonds with a lot of the nurses and medical staff,
Yeah.
right? Um, and refresh my memory with the biopsies. Did you have to get one every single time after you finished the
No.
no?
So it'd be like, so I got it. Before I got my 2 weeks off, I had a biopsy, and then it was after so I got like 4 weeks on, 4 weeks off, then another four. So okay, I'm making this so confusing. Halfway through, I got one, and then at the end, I got one.
Okay, perfect. And did it show progress each time, or?
Yes, yeah, it looked better and better every time. And then the last one, it was like nothing, no cancer. So it was all good at the end.
Wow, that's amazing. So why
Mhm.
don't you describe that day? So it was the after you'd already done the fourth cycle outside of the hospital, basically. Um,
Mhm.
and then did you get the biopsy right after, or?
I got it done. So I finished, like I did my last infusion, and then the next day I went back in
For
for
the
the
bone marrow
biopsy. For the
biopsy.
biopsy, yeah.
Okay, and then they were able to tell you how long after?
So I didn't go. They didn't tell. Like it's like my dog. So basically, this is so confusing. So when the halfway done, like it was like the cancer was out of my like my blood cells, but it wasn't out of like my DNA. But I was progressing so well that my doctor was like, "This is like you're gonna be like fine." And then he called me. I'm like confusing myself.
That's okay. That's okay. I mean, we're talking big picture. We're talking big picture for people. So, the last one that you did, the last bone marrow biopsy, was
Yeah.
after you'd finished your cycles, right?
Yes. And then, and then I went in like a couple weeks later, and then he was like, "All good. You're good."
Okay. So after the last bone marrow biopsy, it took a couple weeks for you to see him again.
Hmm.
But he largely had already told you, like, you're fine. this is just
Yeah.
sort of the cherry on top to really make sure that it's okay.
Yes. Yeah.
Okay.
My doctor was always just like, "You're fine, McKenzie." Like, and I was just like, sometimes I'm like, "I don't feel fine."
Did you get along with the doctor really well? Like, do you have any wishes that he was more like a certain way or?
No, I really like my doctor. He was great. He always made me feel kind of like at ease. Like always sometimes like he would always make me feel like there's nothing to worry about.
Okay, and that's what you really enjoyed.
Yeah.
Do you have any, sometimes we talk to people and they have messages of being advocates for themselves sometime during treatment. Did you ever at any point in your treatment or after have to sort of fight for something or advocate for yourself?
Um no, not really. No, not really.
That's great. That's great. No, that's great because, the message is there for people if something doesn't feel right, just to go with your gut. But it sounds like you had a great sort of like more seamless time. So that's good.
Mhm.
Um, and then what happened after that last results? Did you have to go for follow-ups?
Yeah, so I go every 4 weeks to see my doctor, and then every 4 months I get another biopsy. So I got a biopsy. So I got my last one, and then I got another one in March. But then I see my doctor every 4 weeks, except for like this month I'm not going to see him because of all the corona craziness. But I have been going to like a local place to get my blood taken, and it gets sent to him, and then I have a conversation over the phone.
Gotcha. And that's still every 4 weeks. And is that for how
Yeah.
long does that have to go on for?
For the first year. And then I think after that, and then after that, I see him every like 4 months, and then I think I get a biopsy every 6 months, and then it's just gonna get less and less biopsies.
Yay. So as we like wrap and go into more of the personal side of things of this experience, um, how has it been? Like it's great, right? You got this wonderful news, but how has it been after treatment for you, adjusting?
So I feel like when I was done, like it didn't really hit me. Like I feel like I just kept myself busy, and it's just like, woo, like I finished it. But then now I feel like since I've like had to stop everything has been like hitting me. It's like, wow, like I don't know, like that was crazy. I can't believe that happened, and like I don't know, like my year of like being diagnosed was really emotional. I feel like sometimes like stuff happens and I think about it and I'm like, wow, like I can't believe like that happened.
At
So
least
I do get I'm a very emotional person, and sometimes it'll hit me and I get very emotional.
I think that's so understandable. You went through a lot and maybe now you're just processing it. Do you think that's what's happening?
hmm Yeah, I think so.
What has helped you in terms of just like mentally when things were, going on and it was like seemed like maybe it was not ending? What got you through?
I feel like my friends and my family like really helped me get through everything. Like they were always open to like listen to me talk whenever I wanted to, and like they were just always there for me. Also like when I was going through treatment, like I read a lot of books, like just like mindless books, like I wouldn't have to think about anything. That really helped me too.
So books and being able to talk to people you are close to, your family and your friends. Did you find, quote, your community of people who also have the same kind of leukemia?
I like never met anyone with the same leukemia as me.
Do you feel like it would have been helpful at the time?
I think so. Like just to know that someone like went through like the same thing that I went through. I did go to a young adult conference of people who had cancer, and I did meet girls there that like had cancer, and they're all around the same age as me, and it was helpful to like talk to them. Obviously our experiences were differently, but some things were similar, and it was like really nice to just talk about them like to people who actually like who get it, like because like obviously talking to your friends like they can listen, but like they don't like they just like they don't get it in the same way of someone who went through it.
Exactly, right. You need people who really truly understand on that ground level what it means, right?
Yeah.
And so for you, if you had to pinpoint something that you'd really love to focus on in terms of like a topic, what would you like to tell people? What would you like to talk about? Is it about being young with cancer? Is it about, dealing with the emotions of it? Is it about after treatment's over, how hard it can be? Or
I don't know. I think that like those are all important. I don't know. Being young with cancer is like weird because like when you're 21, like that's the last thing that you expect to like have to go through. And like I was in school too, and it's just like it was just like no one expects when you're in your 20s that you would go through something like this. Like especially like when I thought of like someone getting cancer, it's like when they're like older, like not when they're young. So I think those all, but like being young with cancer is like something too.
yeah, it can feel pretty lonely.
Yeah.
How has it changed your perspective on life? Good, bad, neutral?
I think it's changed my perspective for the better. Like I feel like before like I just like worried about like everything, like every like little thing, and I feel like now going through it, it's like it gives you a better perspective. It's just like I don't know, I got through that. I can get through anything, and like I don't know, yeah.
That's powerful. No, that's powerful. It's a great perspective, and it helps you with not stressing about the little things, right? Looking at the bigger
Yes,
picture.
exactly. Hmm.
Okay, so my last question to you is, people who are watching your video, reading your story today, might be at different phases of the cancer experience. They might be a caregiver, but what's your message to people who might be kind of nervous about they just got diagnosed or someone they know just got diagnosed with the same leukemia?
I don't, just like I know it's so cliche, but just like stay positive and like you're gonna get through it, and like your loved one will get through it, and just be patient with yourself, and like what you're going through is different than what some people will never go through what you're going through, and like you just need to be patient with yourself.
Okay. So yeah, just be kind to yourself, right? Give
Yeah.
yourself that
Hmm.
time and that space. Okay. Thank you so much, Mackenzie, for taking the time to share your story. And we're so happy that you're doing well.
Oh, thank you for talking with me.
Okay. So we'll make sure to put your story on the website and at thepatientstory.com. So we'll be really excited to put that forward. And
I'm
yes,
excited.
thanks so much for joining.
Thank you so much.